Teamwork on 7 West is very important to us, and when you become a patient on 7, you will notice that we take a team approach to your care. Each morning, the nurses, social worker, and case manager make rounds and discuss your plan of care with you. We will be rounding in your room at least once or twice to make sure you have everything you need for a safe discharge. We have a knowledgeable, friendly staff, always willing to listen and help you on the road to recovery. Our physical therapy staff works one-on-one with you to maximize your well-being.
Hi, my name's Michelle and I'm one of the physical therapists that works up here on the orthopedic floor. My role in this joint camp is to help explain to you how therapy will help get you better and stronger after you have surgery. Now, depending on how you're feeling after surgery, what time you get up to the floor, what your doctor's preference is, physical therapy will likely be in your day of surgery to help get you up out of bed and moving and up into a chair. Don't worry if you're not feeling great, it's not something that we push. Okay. Over the next few days, you will get physical therapy twice a day, and depending on your needs, occupational therapy 1 time a day. Physical therapy will focus on range of motion exercises, strengthening exercises, getting you up out of bed, walking, up and down stairs, in and out of a car, whereas occupational therapy focuses more on getting you dressed, on and off the toilet, in and out of a shower, and helping teach you some adaptive equipment to help make you independent. Some of the things they do use is a sock aid, which is a tool that helps you put on your socks by yourself. They may also show you a reacher, which is this. They'll show you how to use it. They also have long-handed sponges, long-handed shoe horns, commodes, shower chairs. They'll go over all that stuff with you. The main goal of both therapies is to help get you independent, get you moving, and get back home. If you're going to have your knee replaced, again depending on surgeon preference, and if you have a nerve block, you may come up out of therapy in this. This is called a knee immobilizer. What it does is your quadricep muscle is weak at the time after surgery, so this brace helps keep your legs strong so that you don't buckle when you're up moving. The length of time you wear it is again going to depend on surgeon preference, and your therapist will help guide you into how often you need to wear it, how you put it on and off, and those sorts of things. If you have your hip replaced, you may come up out of surgery with this big wedge in between your legs. What this wedge does is it helps you follow your hip precautions. Again, those vary by surgeon, but most of them have 3 main ones. The first one is no bending past 90 degrees at your hip. That probably doesn't make a lot of sense to you, but we'll explain it to you. It has to do with how you're going to get in and out of bed, what sorts of chairs you'll get into and out of, those sorts of things. The second one is that you're not allowed to turn your toe inward, and that has to do with rotation at the hip, and again, that'll make more sense when you start getting up and moving. And the last one is no crossing your legs, and that's where this wedge comes in. It helps give you a good reminder not to cross your legs. So therapy's main goal, like I said, is to help get you moving and get stronger and get home. You're going to experience some pain, especially when you're doing your therapy. We do try and work with nursing to get your pain meds before therapy, but do expect that you're going to have some surgical pain. It's a tough surgery, so we got to work with you and we got to get your pain better, and that'll start with you getting up and moving. We do also work with social work to come up with the best plan for you to go home. Oftentimes people do go right home with home therapy, but sometimes you do need a little bit more therapy before you go home. There are different options with which the social worker will help decide what's best for you. Overall, the more motivated you are, the faster you get better, the stronger you are, and the faster you get back home and back to what you like to do. Thanks.
My name's Nicole. I'm the social worker for 7 West Ortho. My role here with Joint Camp and with your services is to come in to see you the day of surgery or the day after surgery, depending on what time you come in, to talk to you about your home situation, equipment you have, and services you have in the home, so that when you're ready to leave us, you have a safe discharge plan. Questions I'm going to be asking you would be, what kind of equipment do you have? Who have you used for home health care? Who's at home to help you? Because that's extremely important. When you're having hips and knees done, we need to know that if you're going home, that you have somebody who's going to help you at home. If you're not going to have somebody help you at home, I'm going to be asking you, where do you want to go for rehab? There's going to be a list in your packet that has skilled nursing facilities. I strongly recommend that you go tour some of these facilities. So if you need to go at discharge, which is usually day 3 after surgery, that we can make referrals there and get you there safely. Some people also want to go to our 6th floor rehab, which doctors will write orders for and consults for. If you qualify to go there, that's great, but if not, we're going to have a backup plan. So again, my role, I'm going to be bugging you, asking you all sorts of questions, but my goal is for you guys to have a safe discharge plan, whether that's home with home health care services, going to a skilled nursing facility for rehab, or going to our 6th floor rehab.
We want to meet your needs as best as we can while you're here as a patient and maximize your health while you're here.